Today I'd like to talk to you about headaches. Cervicogenic headaches, cluster headaches, migraine headaches, headaches in general. What causes them and what you can do to get rid of your headaches.
There's two things that I've discovered about people with headaches. The first thing is their brain activity goes down. You'll notice these pictures here on the right, they're bright and colorful, lots of brain activity. The pictures on the left are dark, not very active. This is what happens with people with headaches, is their brain activity goes down. Think of it like a light on a dimmer switch. The brain is on and it works, but the dimmer switch has been turned way down. The second thing that happens is that the brainstem, which is shown here by this colored area, becomes overactive or even hyperactive. It's the job of the brain to regulate the brainstem. Well, if the brain is underactive, it fails to regulate the brainstem properly, and therefore the brainstem becomes hyperactive. One of the things the brainstem controls is the blood vessels in the brain. Because the brainstem is hyperactive, this causes the blood vessels in the brain to spasm, or to dilate and constrict quickly and repeatedly. This is a picture of a blood vessel. Work with me, okay? These black lines are a web of nerves that surround the blood vessels in the brain. So when these blood vessels spasm, it irritates this web of nerves, which then sends a pain signal. And guess what? You've got a headache. So the cause of your headaches is the underactive brain failing to regulate the brainstem. So to end your headaches, you've got to increase the impulses coming out of the brain. And there are natural ways to do that. For example, if your medical doctor gives you an anti-seizure medication like Neurontin or Topamax, they're giving you that to slow down the brainstem. The problem is it doesn't slow down just the brainstem. It slows down the whole brain. One of the most important things I give you is a thorough evaluation to find out exactly which part of your brain is underactive. If your brain is underactive, there are three things it needs to heal and be healthy. It needs oxygen, it needs food, and it needs activity. One of the things that makes my office unique is that I offer oxygen therapy. Oxygen is fuel for the brain. So in many headache cases, I provide oxygen therapy. The brain also needs good food. If this is an issue, I will work with people to help them eliminate the foods that lead to pain and help them add those that provide energy and vitality. The third thing your brain needs is activity. You're probably familiar with the idea that the right side of the brain controls the left side of the body, and the left side of the brain controls the right side of the body. So I may do adjustments on one side of the body to stimulate the opposite side of the brain. I may do sound, smell, visual, or other movement therapies on one side of the body. All of these are designed to jumpstart the malfunctioning side of the brain or turn up the dimmer switch. The kind of headache you have will determine what therapies you need. But most importantly, by using these therapies, I help you get better faster. Frequently, I'm asked by women, why do I get headaches around my menstrual cycle? If this is the case with you, you need to know that there's a part of your brain that's called the hypothalamus. It's the top part of this picture. And it tells the bottom part, or the pituitary gland, to release hormones. If your brain is underactive, it's going to mess up the impulses to the hypothalamus, and thus mess up the hormone release of the pituitary gland.
I've helped countless headache sufferers over the last 12 years. And if you're looking for lasting headache relief, I'd like to be able to help you too. If you would like to sample for yourself how I've helped more than 93% of headache sufferers become headache-free, use my 3 free introductory visits. Those free visits will include evaluation and other diagnostic testing, as well as introductory treatments, so you can sample for yourself how brain-based therapy will end your headaches. You don't have to suffer any longer. simply call my office at 801-225-1311. If you'd like to learn more about me, you can go to facebook.com/Ask Dr. Ned. There you'll see photos of me and my family. You'll see other videos, links to my blog, and all kinds of other fun stuff. So you go there and I hope you enjoy it. If you've liked this video and would like to see more, shoot me an email at drned@juno.com. That's drned@juno.com. Thanks for watching.